Hi, this is Dr. Vivek Sasindran and welcome to yet another episode of ENT Talks. Well, today I would be discussing about a very commonly raised question. Doctor, does a hearing aid usage lead to hearing loss? So something that we all need to understand is that hearing aid is none of the modalities of patient when it comes to a patient with hearing loss. And the most common indication is sensorineural hearing loss. In our previous videos, we have done or discussed in detail about the different types of hearing loss and the treatment options that are available. While majority of the conductive hearing losses can be sorted out either medically or with the help of surgical interventions. Now, we do have a very small subset of patients in whom hearing aid would be optional. However, the most common indication for hearing aids would be sensorineural hearing loss. Now, whenever we advise a patient to undergo a hearing aid trial, a very commonly raised question is, will the use of hearing aid lead to worsening of my hearing status? Now, this is a very common misunderstanding that people have in our community or in our society. Now, what you need to know is that this is a device which just amplifies the external sound and delivers it to the ear. So the use of hearing aid per se will not lead to hearing loss. So you need to understand that most of these conditions could be progressive. So the natural course of the hearing loss would be such that there is a reduction or a deterioration of the hearing levels over a period of time. It's not because of the use of hearing aids. However, what we need to understand is the fact that early initiation or early use of hearing aids, especially in patients who have sensorineural hearing loss, to a certain extent could slow down the process of worsening of the hearing loss. Thank you.